Chronic pulmonary diseases. COPD stands for chronic obstructive pulmonary disease. It's a chronic inflammatory lung disease that causes obstruction in the flow of air through the lungs. The condition is usually caused by exposure to irritating gases or particulates, most often from cigarette smoke. Those with COPD are more likely to develop heart disease, lung cancer, and other health conditions. According to the National Institutes of Health, about 12 million Americans are diagnosed with COPD each year, and 120,000 people die from it. Symptoms of COPD are shortness of breath, which is worse during physical activity, wheezing, chest tightness, chronic cough, frequent respiratory infections, lack of energy, unintended weight loss, and swelling in the lower extremities. How can a home health aide help? If your client smokes, encourage them to quit. Encourage your client's family to either quit smoking or limit smoking to outside the house. Assist them to manage oxygen therapy if they use it. Avoid respiratory illnesses. If you feel sick, do not enter the home. Help them get regular exercise and provide them with a healthy diet. COPD is a chronic disease, so that means that your client will be somewhere on the spectrum of wellness. What is normal for your client could be very ill for somebody else. For example, your client might get severely short of breath when walking across the living room. This would not be normal for a client without COPD, but for your client, this is normal for them. COPD is eventually fatal. If you're caring for someone who's at the end of their life, their breathing will be very bad, even on good days. What's important is the change in their condition. If they once could walk across the room and now they can't, that is significant, and they must be assessed by their doctor. Cystic fibrosis is a hereditary disorder that causes cells that produce mucus, sweat, and digestive juices to secrete very thick and sticky fluids. Instead of lubricating these organs like the lungs, these secretions act like glue and block tubes, ducts, and passageways. People are born with this condition, and with treatment can live even into their 30s or 40s. People with cystic fibrosis are extremely susceptible to respiratory infections and can often develop chronic infections that are very hard to treat. If you're working with a child or young adult with cystic fibrosis, you must protect them from respiratory infections. Never enter the home if you are sick, and be very vigilant with hand washing.